but it basically we're bringing down the diagnosis time for TB from, let's say, 3 or 4 days sometimes to literally minutes, right?
Let me shift a little bit because you mentioned drones and technology, et cetera, and you've been an early advocate for AI in public health.
Correct.
Um, how do you think technology can help in all of this?
Yeah, well, I always talk about the concept of AI being assisted intelligence. So the concept is basically assisting humans or augmenting us, for example, to do things better. For example, I met a company last year at a health conference in Dubai where they managed to find a faster way to diagnose TB. But it basically we're bringing down the diagnosis time for TB from, let's say, 3 or 4 days sometimes to literally minutes, right? So you can cure a lot of people. You can give them the right treatment because we know that if they've got TB, for example, you can say okay within minutes. Because what happens a lot in these countries is that you tell them to come and have a check. They have a check. If they have TB, you can't find them. They've got to go back to their village or their city, and they're working. And they're not going to come back and make a journey back to say, oh, by the way, you've got TB. Take this medication. So, how we can leverage AI for things like that. A lot of this stuff, a lot of diseases are basically just catching the sign too late. And when it's too late, then of course it becomes a problem. If you catch
Mhm.
these things much earlier on, where you're looking at obesity or you're looking at cancer or you're looking at infectious diseases like malaria, TB, HIV, for example, then you can inform people much earlier on. Now, a lot of stuff he talks about in the books that even when they do autopsies in America on 16-year-olds, maybe sadly they were in a drive-by, they could already see from their arteries that this person in the next 5 to 10 years is going to have heart disease. That's a 16-year-old. Why
Wow.
wait till they're 40 years old when it's too late? You can just start doing this at 16 years old or 15 because obviously they've been eating something. Their lifestyle has already had such a huge impact that already having clogged arteries at 16 years old, let alone at 50 when it'd be a lot more difficult to fight it. I'm not a health practitioner, but just like reading some books and stuff like that, I'm just thinking, why is anybody doing this? Like really basic stuff, like what you eat, what you should avoid eating.